The end of the try was like a disastrous inflammatory reaction, and there was a very big complication about this application. He used this lipoma like a breast implant to the breast, so that was very new idea and was very clever thing, by the way. Let's look into the breast implant developmental history today. The first try was done in about lately 19th century with Vaseline and paraffin injection to the breast for breast enhancement purpose. This try, the end of the try was like a disastrous inflammatory reaction, and there was a very big complication about this application. After a couple of years, another surgeon had a very brilliant opinion about the breast augmentation surgery. He did remove the lipoma from the body, from the lower back, and he used this lipoma like a breast implant to the breast. So that was very new idea and was very clever thing, by the way. But the end of this surgery also was not that much successful. In the early time of 20th centuries, there was a lot of different substrates that used for filling the breast out, like fillers. There was different things like glass balls, ivory, ground rubber, or ox cartilages as well. And none of them was satisfactory, and all of them that caused a very serious inflammation and infection, and none of them was successful enough. After then, in the mid part of 20th century, some surgeons tried some kind of rotational flaps from the trunk to the breast, and these applications were more successful, but they were making a lot of scars and some kind of problems, especially on the donor area. In 1920s, first silicone fillers tried to apply for breast enhancement treatment, but all these applications also caused like big complications and severe infections. The first breast implant try was in 1961, and this try was an individual try of a surgeon, and he did use a silicone-filled breast implants for a patient, and this was more successful than the other fillers and the other substrates and the lipoma also, but it did need to have some kind of more research and developmental things. And the first manufactured breast implant was made in 1964 in France by Ersin laboratories. These first implants were saline-filled implants. They were not like a gummy bear cohesive silicone-filled implants. They were saline-filled implants. And after a couple of decades, this technology of the breast implant developed more and more. And today we have new generation and much more safer implants. We still are using the saline implants in some kind of specific cases, but mostly the implants are silicone-filled gummy bear cohesive implants. They have a silicone shell around them also. And by time, with the investments of the companies and with the demand and request of the patients, there were a lot of hundreds of different sizes, shapes and dimensions and the profiles of implants and with different surfaces. So we have a lot of options for every single patient, and companies are making still a lot of investments to develop the technology of the breast implants, and they are making our job easier and give the patients more options and give them the exact things that what they need and what they request from us. Let's say this is the historical development of the breast implants, and the first tries more complicated and they were like an experimental things, and most of them ended like disasters for the patients. But these days we are able to do all these operations in safer conditions and more satisfactory. Thanks for your interest and watching us, and please remind to subscribe us, and if you have any question, anything you are curious about, just put your comments below. Thank you. Bye bye.